What next if trabeculectomy fails? Good morning, one and all present here. I'm Dr. Sonika PORWAL. And by the end of my talk, I'll make sure that everyone gets convinced that Trab revision is the best method. Multiple factors contribute to the failure of filtering surgery. Most common one is subconjunctival fibrosis. And with a previously failed trabeculectomy, this risk is even higher. Rate of failure has been reported to be as high as 23 to 51% at 5 years and 52 to 59% at around 15 years, even with anti-scarring chemotherapy. So what's next? Do we repeat a trabeculectomy? There are various studies done. Long-term outcomes of repeat trabeculectomy have been shown that the failure rates of retrabs are from 59.7% to 68%, which are too high. A study conducted by my dear opponent, Dr. Sujini Shroff, she stated that failure rates are around 40 to 70% for retrabs, and also said that in countries where patients may not be economically sound and only a few surgeons may be trained in drainage implants, even glaucoma drainage devices may not be a good option. So do we put glaucoma drainage devices? Treatment outcomes in primary tube versus trab study, after 5 years of follow-up, have shown the failure rates to be around 33 to 42% in tubes and 28 to 35% in trabeculectomy, with a complication rate of around 50 to 58%. So can we not rescue a failed bleb? Who is our superhero? Yes, it's a small needle. It is needling. Needling is like a CPR. It's like a CPR of the bleb. Why not try it? There is no harm. A systemic review and meta-analysis done to study the safety and efficacy of bleb needling with antimetabolite after trabeculectomy failure was done, and it showed that the reduction in IOP of around 9.74 millimeters of mercury, with a complete success rate being 45.9% and a qualified success rate was 70.4%, which is very good. The anti-glaucoma medications, around 20 studies had a record of reduction of anti-glaucoma medication usage before and after bleb needling. Needling will also alter the morphology of failed bleb. Flat blebs and scarred blebs will look like a diffuse filtering blebs. I don't say that there are no complications. Conjunctival hemorrhage, hyphema, bleb leakage are the most common complications which can be handled by observation and by conservative methods. So why bleb needling? It is cost effective. This surgery is minimally invasive. I would call it a procedure. And it is repeatable. Compared to retrabeculectomies and tubes, no new conjunctiva is involved. It is less invasive. Cost can range to 0 to 10,000 depending on where do you do the needling. It is repeatable, and post-op care is also less when compared to a retrab or a tube. So I conclude the procedure does not sacrifice a new region of fresh conjunctiva. It can be repeated. The revision may be performed at the slit lamp in a minor procedure room or in a main OR. In younger patients, performing needling first may buy you 2 to 3 years and keep more options available for future. Exhausting salvage measures before resorting to resurgery is the art of preserving what remains while striving for what is possible. Thank you.
Thank you, Sonika.